Morning, everybody. It is way too early in the morning. It's still dark. If I turn off the lights, you wouldn't see anything. But we need to do a treatment for PD. This will actually be the last wound treatment I'm going to do on him. His wounds are looking pretty good. So I wanted to share with you what our process is. So in case this ever happens to you, you guys have an idea. Now, first thing we're going to do is we're going to clear out his bin. And I know that he is asleep. Well, was asleep. I'd be asleep though too. We're going to take everything out. Dump his water. My baby. He's in shed right now, which is great. It's what we want to see. See, his eyes are clouded. He's blue. But that's good news. It means that he is repairing those wounds. So something we're going to see. So first thing I'm going to do is I'm going to go ahead and spray down this bin now that I've got everything out. I'm going to keep the bacteria load down. Oh, buddy. And I'm going to let that sit there. Minimum of 2 minutes, maybe longer. I'm also going to spray down his water dish. So you want to make sure it's nice clean. So I like to get some antibacterial stuff in there. I'll let that soak for a couple minutes. And while that's soaking, we're going to go ahead and give Petey a sponge bath. He is not fond of it. He may actually, and he has in the past, tried to play dead because, again, he did not like that rub down. And I've got to keep this wet. Sorry, baby. But we're using the same stuff that we're cleaning the enclosures with. Because I believe this is, I said this in the wound kit, or the emergency kit, I believe this is a chlorhexidine based solution. So, and even on here they say it's good for, cleaning enclosures, it's good for wound care, but we want to get the extra Silvadine or silver cream off of him. Hi, baby. I'm sorry, I know I woke you up for this junk, huh? Hold on. I think this is going to stain more with his cells, his skin getting ready to shed. It's drying out, I know, sweetheart. We're going to try to get this stuff off as best we can. Yeah, he's not happy. He must phone me. I'll grab another towel. We're not having this. I'd rather not be doing it. Their enclosures actually cool down at night. Sorry, baby. So I definitely woke him up for something he does not enjoy. I know, sweetie. They're still musking. In fact, I think we're trying to play dead because he wants me to leave him alone. Oh yeah, we're dying. He died. Sorry, my dude. Famous hognose death. Almost done. I really want to get this area. So that's where the wounds are. And he is not about that. You're okay. Alright, well, I think that is probably good enough for him. So we've done that. we're going to clean out the bin. Wipe down the bin and put some new towels in here. I know, there's going to be all kinds of unhappy. I'm so sorry. Even the cats are mad. Pretty good. You want to get most of that moisture out. You don't want them breathing it. Now we're putting down 2 new paper towels. I kind of tore that poorly. Now, you could, my sweetie, you could ideally also clean these down. I'm not going to do this today. I'm not too worried, but early in the process, it was a good idea. Again, his wounds are pretty well healed. This will be his last treatment. His water dish, I'm not going to put it back in right now, but I am going to wash that out with hot water. My baby. Get that nice and clean and put it back in there. She's got fresh water. So there's that. All right, so the next part of this is going to be to do the iodine. I know you're so mad, huh? I woke you up for this junk. You can't see. It's just not great. All right. Are we still playing dead? There we go. You can hide. All right, so we're going to take our cotton balls. Now, early in the process, like I said, you want to wear gloves. So we had some, they were sterile at one time. Now they're definitely not sterile. They got wet on the outside. But we got some gloves there. Try to minimize how much, I guess I shouldn't have put that back yet. Minimize how much bacteria of ourselves that we're giving them. Really the first part of this is to make sure your hands are clean. I did do that before we came out and started recording. But we're going to put a lot of this iodine in. Okay, it's not leaking now. It was leaking the other day. But we're going to find where all the wounds are. So I know he's got, oh, he already knows what's coming. He's trying to play dead again. I'm sorry, baby. He is not one to really play dead, so. That wound's over here. We know there's a wound over here somewhere. Oh, sweetie. You can see one of the wounds right there. And there's one. There's no place to hide, I know. And his tail tip had a whole bunch. And he has actually got one right here. So that is all the wound sites. Evident by where I put the cream previously. Alright, or the iodine before. Next one, Silvadene cream. And this stuff, again, like I said, it helps with repair of the skin cells. But what really helps with repair is heat or warmth and food. You gotta have calories to heal. I know, it's the worst part, huh? Calories to heal. I guess I got the one on the top of your head. And warmth speeds up the repair. So we're not so warm right now because we were just in our sleeping mode. You already can't see, so I don't want to stuff on your eyes. I'm sorry, baby boy. And now we hate it. Rest of his wounds. If I know where they are, you're going to tag them, but I just put down the worst of the wound, which is going to be the last one to heal. So we've got that. So you might be wondering why we did this so early. And the reason is I've been giving him his shots right before I go to work. Alan's over there yawning. Sorry, everybody. But I've been giving him his shots right before I go to work. So it is important that we try to keep that schedule. And the reason why is when medications work best when they're given on a schedule. The antibiotics are wearing off until you give the next dose. So let's say I wanted to sleep in and I don't do this till noon. That gives any bacteria that's remaining chance to not only increase their immunity to the antibiotic, but they're also their ability to reproduce. So we'll have new bacteria that develop in that time that have that immunity to that bacteria or the antibiotic. So same time every day is what we're going for. Not every day, but every 3 days in this case. So on the snake, I'm so sorry, dude. What we're gonna do is we're gonna look for the widest part. And he's a long boy. I'm actually gonna say we're pretty long. That I think right about in here, a little bit lower. Right around in here is going to be his widest part, which is thankfully clean. But we've got our antibiotic. Go ahead and uncap it. Nice, sweetie. So what we're doing now is we're going to check for the spine. Here's our spine. And we're going to go to the side of it. And we're going to go in about a 45-degree angle. I think I did the other side the last time. Trying to rotate it, but you want to go kind of underneath the scales. We're going to lose him. All right. I'm going to try that again. All right, we're gonna look, get the sleep out of my eye. In between the scales. I think I'll actually go under this scale. And we are in. And we are injected. Now it's recommended you may want to massage it in just to make sure it gets in. I'm sorry, baby. You now just give me all of your cream. The medication's in. He's gotten his shot. He's not happy. Oh, sweetie. So we're going to go ahead and put him back. Get him back into his closure, get him warm, let the medication work. Last important thing to do, you always want to recap your needles. And if you have a sharp spin, great. In it goes. If you don't have a sharp spin, what you can do is take an appropriately sized, large sized solid container of some sort. It could be an old Tylenol, ibuprofen bottle, something solid like that where the needles are not going to poke through. You can put them in there and you can use that to dispose of them. It is very hidden. Yep. But you want to protect, people don't know what it's been used on. They just know in case something happened. I just got a needle stick. I don't know who has used this. Well, in this case, we use it for a snake, but they're going to freak out. Even though we know they're fine, they don't know that. And they'll no way typically knowing where it came from either. Hi, sweetie. So you want to protect them. Put it in some kind of solid container. And then as far as disposing, you can. It's not encouraged. You can just toss it into the garbage. We don't do that. We actually can take ours, since we work at a hospital, take ours to a hospital, a clinic. Sometimes pharmacies will do needle pickups, especially if you're diabetics, and disposals. It should be incinerated, honestly. But we realize that's not an option for some people. As long as you have that secure, that's what really matters. But there you have it. We're going to go ahead, clean out his water dish, give him some fresh water. And that harassment of him is done. He is going to shed. We have, I think, just over a week's worth of injections left. Tuesday will be 2 weeks, obviously. The injections are typically for 21 days. I didn't actually count, but it's probably correct. I think we had 7. Sorry again. But, yeah, 21 days. And then, you know, from there, hopefully we're good. He'll have completed his treatment and should be out of that danger zone. He still is. That bacteria, again, if you don't treat him properly, that bacteria can start reproducing. It can become resistant to the medications. It can take over. It can win. So shots, absolutely important that you do them, and preferably do them at the same time every time they're due. Keep it consistent. But most importantly, just make sure he gets their shots. So that's it. That's our treatment for Petey. He's doing great. He's getting ready to shed, so we know he's healing. Would love to see when he comes out of shed what that wound looks like. But thank you for joining us. Take care. We'll see you next time.